Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with me is Dr. Abu Bakare. He is an endocrinologist and is also associate professor at Northern Ontario School of Medicine in Thunder Bay, Ontario. Today we are going to talk about diabetes. Diabetes is a condition in which the blood sugar level in the blood becomes very high. Normally, pancreas produces a hormone called as insulin, which breaks down the sugar ingested through the food. In diabetes, either insulin production is reduced or absent, or sometimes there is resistance to the action of insulin, resulting in high level of blood sugar. This high level of blood sugar causes damage to various organs, resulting in cardiovascular disease, stroke, kidney disease, blindness, peripheral vascular disease leading to ulcers in the leg, and sometimes needs amputation and many other serious complications. In 2016, it is estimated that 11 million patients were diagnosed with diabetes and prediabetes in Canada alone. And by 2026, this number can go to 13 million. From 2006 to 2016, the prevalence of diabetes increased at the rate of 72%. And in coming next 10 years, this will go by 42% more. So we can see that diabetes is a very significant disease all over the world, and it reduces the lifespan of a patient by 5 to 15 years of age because of the complications associated with it. So today, with the help of Dr. Bakare, we will understand what diabetes is, what are the preventive methods, and what are treatment options available. Thank you, Dr. Bakare, for your time. Really appreciate it.
Well, it's nice to be invited, and I'm glad to be here. So,
please tell us about type 1 and type 2 diabetes, what it is, who gets it?
well, typically, type 1 diabetes is a kind of diabetes that occurs in the younger age group, usually less than 40. Their kind of diabetes is such that they almost always require insulin. And if they do not get insulin, they will get into what we call ketoacidosis. On the other hand, type 2 diabetes is typically in a patient more than 40 years old and typically also obese. And these patients can actually do without insulin for quite a while, depending on how far down they've been in the disease pathway. And it's only in the end that they will require insulin, but invariably can be treated with oral medications before they go on insulin.
Right. So you say type 1 is always in young patients. So what age it can start?
Well, it can start as low as 1 week.
Wow.
There are patients who are diagnosed within the first month of being born as being type 1 diabetics, and they have to be treated immediately. If they are not recognized, they obviously will die.
How common is it? Type 1 diabetes in young children?
Well, type 1 diabetes is not very common. And in general, type 2 diabetes is the most common kind of disease. It's 80% of diabetics are type 2.
Type 2.
And it's only 10% that are type 1. So it's a very small group.
Right.
It's certainly not as prevalent as
So in
type 2
what we
diabetes.
see is most of the patients are type 2 diabetes.
That's correct.
Now, what is pre-diabetes?
Well, prediabetes is a stage before the development of diabetes. These are sort of artificial terms that have been created to make a distinction between the levels of mostly blood sugars and more recently what we call a hemoglobin A1C. That is an attempt to classify patients into an area where they can take a lot of precautions before they actually develop full-blown diabetes. And people used to say a touch of diabetes, but that's really a more colloquial term.
Right.
Pre-diabetes, we are referring to specific levels of blood sugars. For example, if you got a fasting blood sugar that is between 6 and 7, you are a pre-diabetic, as long as that blood sugar is repeated more than once. On the other hand, if your blood sugar is over 7, you are now a diabetic patient by definition.
Okay.
We also have hemoglobin A1C levels that are classified as being pre-diabetic and levels that will be regarded as clearly diabetic.
So pre-diabetic is predisposed or prone to go into the diabetes full-blown?
That's correct. So a pre-diabetic patient is more likely to develop diabetes. In fact, pre-diabetic patients followed up for about 5 years, at least about 33% of them will develop full-blown diabetes.
33% of
That's
them,
right.
1/3 of them will get the
Will
full-blown.
become to full-blown.
So what can one do to prevent pre-diabetes going into the diabetes stage?
Well, it's now clearly established that in fact, you could prevent a major amount of patients who are in the earlier stage from developing diabetes if they would take care in terms of diet and other lifestyle changes.
Okay.
There have been studies clearly done in the United States and elsewhere showing that there are ways of retarding the progression from pre-diabetes to diabetes.
Now, who is at risk factor for developing pre-diabetes and diabetes?
Well, the most common risk factor for pre-diabetes or in fact diabetes is obesity.
Obesity.
It's the most prominent factor. The higher your level of BMI or body mass index, the more likely you will develop diabetes. Not at all every obese person is diabetic, but you're more likely to. A family history of diabetes is also a strong risk factor. And certain tribes or races are more likely to develop diabetes than
like Asian countries. We have a lot of
people from Asian countries who are, particularly those who have migrated to the West, are more likely to develop diabetes than.
Is any food is a risk factor for diabetes?
Not specifically. Obviously, a changeover. It has been noted for years that a changeover, particularly among the indigenous population, from their natural, what you call it, natural food to a more westernized food is a risk factor. Even in the Middle East, it has been clearly noted that the changeover from the typical Arab, for example, Arab diet, to a more Western diet, or the inclusions of things like that, clearly, like Coke and all that, have increased the rate that one will normally see in the indigenous population. Clearly, also you will see that in the same population developing diabetes are the same population that become obese and develop hypertension and a few other.
So too much fat, too much sugary.
Too much sugar, in a sense, are contributory.
Contributory to the diabetes.
That's right.
Is physical activity related?
Of course, again, that's another great factor, which is so-called environmental factor, in the sense that the people move less, and if you move less, you eat more, then of course, you are more likely to develop diabetes.
Right. Now, obesity and diabetes.
Yeah.
Can you please explain more about it? Like, how does obesity affects the insulin level in the blood?
Well, the thing is that the more fat you accumulate, the less effective is insulin. So we have an earlier stage in which your body is trying hard to cope with the increased demand on the pancreas to put out more and more insulin to normalize the blood sugar. As long as the pancreas succeeds in putting out enough insulin to normalize the blood sugar, it doesn't matter how much weight you put on it. But if the pancreas then is unable to cope, obviously, then your blood sugar will start going up. And that's what obesity offers to a large extent, because of the fat and the effect of lipids on insulin, is that it reduces the effectiveness of the insulin being secreted. We call it insulin resistance, but it's not in the sense that more and more insulin have to be secreted to achieve a certain level of blood sugar.
Right. Thank you, Dr. Bakare. We'll take a short break and we'll come back. Please stay back for the next part.
Thank you.